So,
what's the point of putting the currency down?
So that maintains sterility.
I can't hear you.
So your drapes maintain sterility? The ones that you're going to play with?
yes.
Establish the sterile field. Okay. So here's two ways this happens. Now, this is going to be the CST question versus real life question. Okay. CST question. You cannot drape. You must drape on the same side of the patient. Okay. Meaning, when we square this patient off with towels, my check must be on the same side as me.
Per CST.
Next question on the test as you move forward. Where do you stand when you're draping with a patient doctor? On the same side.
Same side.
Okay.
So that would put you right here.
Now, when we square off, my first towel goes where? Why is it going in front of me?
For sterility.
To create a sterile field, because we're barrier, right? This is the same all the time, guys. Just gotta keep repeating, right? Second towel is good to go either inferior or superior, doesn't matter, okay?
Do you guys notice how the towels are set up? 3 flip towards me. The last one flip towards him.
Okay. Now, if it had been the other way around, he would be standing over here, passing across this field here. So, in the real world, you're gonna stand across from me. Okay? Same thing's gonna happen. We're not passing over the body, are we? We're passing over a sterile field we created.
Also, you don't want to drag it to the patient. To the doctor. You never drag your towels. It's up, over.
And why do we drape a patient? Why do we drape? Because it's fun? I got nothing else to do?
I needed just one more thing in my day to
I
take care
really
of.
like the color blue.
How big is this hole, y'all?
Big.
It's pretty small, right? Okay.
We do it to isolate the surgical field.
Okay, thank you.
No CC question.
Like so. I'm gonna walk over. Now, if my surgeon trusts me, he'll be like, go ahead, put it down. I'll drop it. Otherwise, I'm gonna hold it up for the surgeon.
And how do you do this the right way? Because the little man says so.
See the little guy under? Head to head, foot to foot. You should be good to go.
Okay. There's stickies on here which we already took off. The rest of us.
You guys remember the white things? The white tape? So I took all those off. Nurse was not around. Just drop them on the floor. We'll get them later.
This is just to the ground. Okay. Once again, we're gonna grab our sheet with two hands, though, right? One hand on the patient and one hand here. But we're not grabbing the sheet down here. We're grabbing it still on top, right? And once again, we're going to cuff our hands. Okay? And extend. If you're too short to extend all the way, you can do a double. You can drop it halfway here and then extend it further up like that. Okay? Once again, two hands, one hand on the thigh or wherever it's going to be. Once again, take it and cuff our hands again and move off to
Eddie. Eddie's our full. That's a little higher. About like that. That's what it's gonna look like. We do surgery here. Let it sag a little bit. Forward. Just walk forward. Same height. There you go. It'll probably look something like that. Okay. Drop it in. Eddie G, everybody. Okay. Now that you're all squared off, how do you bring your mayo up? Like this?
No.
I don't know why we saw the clearance people doing it like that. Look at it, look at it. It rolls just fine this way. Okay? No hassle. Get to your table, it goes up. This is how I know my mail's good. So I can fit my hand under here.
you should have at least 1/5 underneath there.
All the way across.
But if your doctor says table up, though, what does that mean? You guys are going to dig up.
The table's not coming up.
So you still have it low, but you want at least 1/5 underneath there. Minimum.
What if my table's too heavy? I got like 10 trays on here. I can't move it. Can I just grab it and walk backwards? No, can't do that. Never walk backwards in the war. No, but what I can do is put my hands on it and then use my own body weight to push the table with my thighs, my hip. Okay? And sometimes what's going to happen is you're going to have this table that's almost twice as long as this one. They have like 20 trays on it, full steel, everything. It gets super heavy. You gotta get on the other side. You gotta push. So now my doctor's been waiting for me probably. I'm gonna set up my stuff. Here's two things you can do. One, how I do my thing. Okay? Or you can take it and you can try to run it through like that. Okay? I usually measure to the head, put it down. I know my surgeon is right-handed. It says so on the preface card. So I'm gonna set that up for him right there. And
What is the instrument you're using?
that's an Edna. It's a non-penetrating calculator. Last thing I want to do is put holes in my drape. So bacteria and stuff comes from here. Just so you can see what I'm doing. Okay. I'm just taking a little bit of the drapes and just making it so that they're managed. Okay? So that nothing's gonna happen. So whatever distance I have for myself, that's it. Because from here, I can't pull any of this stuff up anymore. So if you don't do this right the first time, you are out of luck, I should say. Okay. All right.
Okay, so, his table right next to the side of him, he's standing behind his mail stand, right? If he's standing over here, he's at a place. Who would be standing here?
Resident, PA, assistant, anything.
But you guys are always behind your stand. That's
Second
what you're
tag.
saying, okay? You also need to have 2 laps up on the field? Okay, and then what we do is call a timeout, and we're gonna go over a timeout later on. But real fast, do you know what a timeout is?
Will you talk about your case?
It's a break for what do we do during a timeout? Verify this, who the patient is, what we're doing,
Right side.
all that kind of stuff, okay, so, once it's done, we'll say we confirm.
I agree.
Agree, and we're ready to go.
I agree. My doctor's right-handed, right? Boom. I have the cap.
These first 3 steps and 4 steps are the same for all surgeries pretty much, okay guys? First I gotta mark the surgical site.
What percent lidocaine with epi as far as
Whenever you use your medication, you must tell me what it is.
you have a good date on it?
So far I have actually. There's you.
Didn't kill anybody?
Not yet. Try not to. Sometimes. I'm cutting the patient. What's gonna happen next, you think? They're gonna bleed.
I was gonna bleed, yeah.
So what's likely is that means I need Bovie next, which means you need what?
Section.
Suction. Why do you need suction?
To catch the debris.
To suck the what? The plume.
Oh,
Smoke the plume. Why do they call it plume? What's in it?
Patient's skin.
Biohazard.
Oh, also, the suction sounds kind of like this here. And in order for it to work, you gotta bring sound effects.
Because if I'm moving for you guys and I'm over here like that, I expect y'all to go.
Everybody say, where's the suction? So,
I'm acting fool. You're gonna act fool. If I don't hear, I'm like, if someone turn the suction on, and I will not move until I hear my suction go. Right?
so you're ready for it. As far as the Bovie goes, this tip comes in and out, the electrode part, right? It can be turned 2 ways, okay? There's a flat way and a sharp way, okay? Think like a knife's gonna cut bread, and then a knife's gonna butter something, right? You want it so that it's gonna do cut. That's how you want it on the way.
Just so you guys get an idea, he's talking about it going this way rather than this way. Okay, so you gotta turn that movie around so it cuts like a knife. If it's wrong.
It also has 2 buttons, a blue and a yellow. Blue is for coag, yellow is for cut. How do you remember that?
You guys know what cut the cheese means?
Yeah.
That's how you know what yellow is. Yellow's like cheese, right? Cut the cheese. Sorry. That's how you remember. on skin, right? How ridiculous would that look?
Kelly, please. Under Kelly. You have a peanut? Mid smoke, please.
He used that peanut. I don't want to give him a dirty one. I'm already ready for a new with a new one.
Kelly, go ahead. Hold that. Thank you very much. We got Alice Long. Okay, so notice all entries up here are clocked, right? Are the ones in your back table locked?
No.
So before you bring it up here, you can you lock it for us. Okay? So easily in your hand, just put it together and just put a little push. And hand it off, okay? So you get over that. So you can't hand things off that aren't locked. Now can I get longer biggies?
Also, I don't know if you guys know this, but he asked me to hold the goulet, yes? Okay, so I took it, and then he asked me for the Alice. So what I did was I anchored my hand via my finger the best I could. So then when I did move, the retractor didn't move with me.
Yeah.
If I'm floating with it and I go to move, guess what's gonna happen?
You're in a pool.
You're gonna be all over the place. And your surgeon's gonna be like, whoa, what are you doing?
Your hands go where your eyes go.
So if I do that, if I anchor my hand here, I can be all in that way. I can go here, 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 here without disrupting that. Okay, it's a little pro tip for you guys.
Tissue scissors. Use sponge stick. So pretty much we're just gonna watch you guys how you pass instrumentation. We're gonna teach you that like in a week or two. How to pass things, how to load blades, how to do sutures. So that's what I'm looking for this mock. Look how you drape out and how you pretty much perform up here, okay? It's not a big surgery. We really just mock surgery. At the end of the surgery though, we're going to say we're gonna close the abdominal cavity, get your suture please. So, when did he hand me? He gave me pickups, right? Whenever you hand off a suture, you must hand off
A pickup.
pickups, right? Once you get to start thinking things go together like peanut butter and jelly, okay? So your peanut butter, you got jelly, right?
A hand cover.
So, your peanut butter and jelly, one of them is always got to be whenever you do a suture, you should be thinking pickups, right? And after that, you should be thinking what else? What comes after this? From suturing, what's next?
Cutting.
Scissor.
Cutting. So your scissor.
Suture scissor.
Okay? So, right now, I'm closing the abdominal cavity up, okay? That clues in the tech to know that he's going to now do the next count. Okay? We do 3 counts during surgery, all right? The first count is done, we set up. The second count is done, we start to close the peritoneum, okay? So, this is now called a full count. So we're going to do a count. We're going to start with our laps. We're going to laps. Now watch how it counts.
1, 2 on field. 3, 4, 5.
Okay, so anything up here is considered on the field, okay? And we count it the same way. We do these 2 count here, and then we do a drop count there. If this thing, if that was on the floor, which is the kick bucket, right? You can't count that. You can look count. We can count from the field to the men's stand to the back table. So go ahead and count again.
Laps. We got 1, 2 on the field. 3, 4.
Who counts the one on the field?
That's okay.
Circulator. Come along and say, here's one more 5. Okay. Now, say we're doing suture now, right? And I'm suturing. Count suture.
1 working. 2, 3.
So, those are different. If I'm using it, it's called working. But up here, it's called the field. Why do we say that when we're counting? For who?
The circulator.
Circulator.
So like
With us.
You're directing their eyes. Working. Where's working?
in his
Because
hand.
it might be in the cavity, right? So she can't see it, but she knows it's working in the field, right?
So they know to look into the hand area and then they can see it. On the field, they know to direct to the field.
Okay. But every time we count, we always go field to male stand to back table. Anything on the field will be counted by the circulator afterwards, okay? So if we're doing now, we're doing say we got all this, the regular stuff, and I've got we're on Kelly's next, right? I'll say Kelly's.
Kelly, we got 1, 2 on the field. don't start in the middle. Because who knows if you are picking up on the right area. You restart the whole count over again. And yes, I will do that too. The second you pick up those right decks, you get the 3, cut! So it's coming. I guarantee you that. And you have to know how to, you gotta know how to cut. Okay? If we use a knife to count things, right, in the beginning, what do you think we should be using to count at the end? Huh? Speak up. You guys are so quiet. The scissors. If we're closing, what's the next thing he's gonna ask for?
Your scissors.
Cut. While I'm counting all this, so why not use it? 1, 2, 3. Cut. It's already in my hand. Go back to counting. Do. Cut. It's right here. Otherwise, I'm gonna put these down. He's gonna say cut. I'm gonna. He's dead. You know what I mean? So
Good.
always have them ready.
Sharpen. And also, keep your real estate clean. Okay? As things come back, we organize them. Once you put them, back to their home. Right? Like we got to do when you need something, it's always where it's supposed to be. You don't have to worry about trying to find things okay real fast. Because if you want scissors, scissors are right there. Where we have them, okay? Okay, once we finish up doing the abdominal cavity and close, we're on skin now. Okay? So we're gonna ask for a skin suture or skin stitch. Right, we're gonna get that, plus we're gonna get what? That kind of thing. Let's start with our pickups.
What team?
Adsons. Why Adsons?
With skin.
We start with Adsons, we finish with Adsons. Right. So now I'm closing up the skin. We're doing a third and final count. What kind of count do we do now?
What's the count called? Soft count.
So once again, laps
1, 2, 3, 4.
and one side. So we're gonna count all the soft count stuff like we did before. And this is the point also where you want to ask for your dressings.
Oh yeah. Nurse, can I get my dressings? Yep, just pop them on the back of my table, please.
Now, why do you think we don't want to put our dressings in the field to this point?
Because they could get contaminated with anything.
Contaminated?
What's the difference between these two?
Oh, mixed up with latex.
What's the difference? You see a blue stripe on it? No. What it does, you flip it over. So if I have my dressings right next to my latex, and my surgeon reaches over, and I turn my back, I come back over, it's now lost. I guarantee you the second that goes in the cavity, it is lost because it soaks up with blood, and it looks just like every other structure in there. You will not find that. You have to call an x-ray, but is there a blue radio light on that?
No.
Nope, it's gonna, we'll talk about your oops project later.